Hello, everybody. This is Dr. Henry Pollard calling or talking to you from the FIX Research Commission, or the RESCO as we call it. And today we're here to begin to introduce you to some of the members of the team. So I'd like to start off with introducing you to Dr. Claudio Merkier, who has just joined the team. And we thought we might just have a bit of a chat and let you know who he is and where he's from and what he does and all that type of thing, and how he plans to contribute to the cause, as it were. So first of all, Claudio, welcome, and tell us a little bit about where you're from and your background.
Thank you, Henry, for the welcome. I'm a chiropractor based in London, United Kingdom. I study chiropractic in Bournemouth in the ACC and graduated in 1997. Prior to being a chiropractor, I was a teacher of physical education. And then after graduation of my chiropractic degree, I moved to London and I've been working since then. I've been moving into a master in sports science in the St. Mary's University College back in 2008, when I done a pilot randomized controlled trial in rugby union. And I've also been involved with a lot of master athletes, especially in track and field.
Okay, well, you've taken up a couple of the questions that I was going to ask you. So how about we dive in a little further and I ask you about, so with regards to the rugby study that you did, so what aspects of the study were you looking at in your participants and your outcomes?
First I was looking about a relevant component of the fitness that is looking at rugby union. There was about some sprint in relation to running velocity and acceleration speed, and also some of the flexibilities, particularly in sit and reach flexibility. The idea of the plan was just to do a pre and a post with the players, and what we did then, we gave a prescribed warm up, so in order just for them to be ready for the test. Then they did the test. Then they done a good recovery, just checking that the blood pressure or heart rate returned to normal, and then we do an assessment. There was no restriction on the area assessment. It would be like a normal pre-competition assessment, where the chiropractor will be able to choose what the areas to treat. Only the restriction was on the intervention group was done in manipulation. And the group that was used as control was in only just jam mobilization.
And the results?
And the results, statistically, was not a significant difference. However, there was a trend of clinical relevance. As we know, in rugby union, any small change can create a big difference on the results. And also was a very small study. That we didn't have the numbers to create some statistical difference, but was very encouraging then.
Oh, excellent. And since then, I believe you're embarking on your PhD studies at the moment, or just finished?
I wish I finished. I'm in 2018. The idea came to fruition. I was thinking of trying to make this gradual transition from clinician to research. And by the end of 2019, I was accepted in the professional doctorate in health and social care at London Southbank University. After talking with different researchers, what would be the best way to introduce me to research? So the first stage of the PhD is you go through a course to introduce into all the modules of research. Sorry.
Sorry about that, guys. I'm in my clinic here. Please continue.
And successfully complete the first couple of years in order to move to the proper PhD program, where I just preparing my proposal to formally be accepted in the program. So because it's all this been done part-time, possibly it will be another 3 to 4 more years of putting the literature review, the investigation, and the write-up of the PhD. But it's a very exciting time.
Excellent. Well, good luck with that and congratulations. So that implies that maybe you're part-time, well, not maybe you are, you just said it. And so you're going to remain in clinic whilst you're doing all of that, or you're going to...
Well, at the moment I will remain in clinic. I will still teaching at university. Mm-hmm. And also hopefully moving into more and more in research. As probably some of you that may know, London Southwark University have a new chiropractic degree. That only has been established for a couple of years and is slowly growing, and is with a great potential to be in London, UK, as the only chiropractic program.
Excellent. So if we're going to take a slight detour towards the clinical side now, describe how you approach your patients. What techniques do you use? What management strategies do you use? Just to sort of give us a little bit of background on how you operate.
Okay, first is I use a person-centered care. So every new patient is invited to take a consultation, examination. We give plenty of time to explain what's the main reasons why they want to come to the clinic. Just we asking about the expectations of care, what the interesting, why they decide to consult our clinic. Then we will proceed after done the consultation. We do a physical examination, including such as a standard chiropractic, orthopedic, and neurological exams, and depending if it's an athlete, they will do some special tests, functional tests, and regarding what can be for the needs.
What tests are they for this special test, the functional test? What would you use there?
Well, I use a lot of.
Perhaps your screening.
Yeah, screening tests. I will use a lot of dynamic neuromuscular stabilization tests that can show a lot of information about some of the basic parts that can be included in the function, and if it's any faulty stabilization or any hypertonicity or imbalances, can be able to bring very early on the examination.
Okay, and how do you, you're a researcher, so I'd ask you fair game here, how do you document your outcomes in your clinic?
Well, the main outcome, we tend to we use an app management. It's called Clinico. So that's on the way that it. Some of the tests they will be as a positive or as a negative in regarding to my understanding, but sometimes you will grade it depending on the scale that we will be using. And this is not one way of adding. And also, you try to refer at some of the standard tests what you should be looking if there's any stability.
Do you use PROMs and PRIMs, so the patient-related outcome measures and experience measures?
Yeah, we use some of that. I use mostly I use a simplified form. This is my MOPS. This is about what the expectations before treatment regarding some kind of pain register on depending of the symptoms or the complaint. Also, just we try to state if there's any issues with the well-being in relation to mental health. And depending what was the case, is sometimes related with a injury related car accident, maybe we will use the neck disability test, or something more specific with the low back, we will use the OS3 disability test.
Okay, excellent. I raised that because I think that that's an area of research that we as sports chiros can pursue a little more closely. So I like the fact that as a clinician, you're implementing some of your research strategies within your day-to-day practice, which I think is something that as a profession we probably need to do a little bit more. But okay, so you're a clinician, and so perhaps I would say to you at this point, what sort of things would you like to look at in sports chiropractic as your career moves forward?
Well, one of the things that as mostly, first I coming from a background of sport before I was a chiropractor. So, and I was involved in sport as an athlete.
Which sports?
I was involved in rugby, and I was involved in athletics. That was the main interest moving to sport chiropractic. Initially, I was involved with local teams, rugby teams, and then I was introduced to master athletes in track and field with what they call the British Master Medical Service, led by Fiona Jacobs in the United Kingdom. So that was my two areas of interest as a sport chiropractic clinician. And that's what at the moment I have developed even further into master athletes for my PhD. That's the topic I'm looking into and more interesting me. But as a clinician, if you not be able to see the patients in the clinic, I was very interested to see them outside the clinic. As I mentioned before, I'm involved in rugby teams on the local teams or some of the more selection teams, or to have opportunity to get involved with rugby sevens in a few groups. Or have the opportunity to participate in some of the big competitions, like more recently in the World Championship of Athletics in London in 2017, be integrated within the physical therapy team and working alongside other professions dealing with the athletes. That was very, very interesting experience.
Excellent. Now, I noticed with interest there, I think your research goals have kind of hit upon a couple of relative weaknesses in the chiropractic research compendium in some regards. Can you perhaps talk to us why it's important to do research on athletes as opposed to university students or other volunteers, and in the aged and in sporting populations? Why is that relevant or important for us? Can we just use research that's published by other people in other populations and make it our own?
Well, the most important, I think, as we all know, the world is getting older. People live longer, and this is an increasing population that we need to start looking into more and more, and it's more relevant. Secondly, as we know that when we're looking about all the people, research, not only in chiropractic, but just in general in manual therapy, we know that most of the research when we're looking about older is being done in people with a lot of comorbidities or disabilities, and very little has been done in all the athletes overall. And I think it's an area that is very relevant as we're becoming more and more populated in the world with over 65. And if you want to have a role in this group, we need to start looking about other populations, not just on the lower rate of all the function
in the younger
population.
Okay,
and it's not, and also just for me to say that this group, we have like in the United Kingdom, we have access to championships nationally and international to train some of these athletes, and I believe there are other sport master population. They also have maybe access to manual therapy, but it's not many. And I believe it's an area that sport chiropractors should be looking more. If I look mostly at the sport chiropractic research, or when you're looking about the majority of the reviews in sport chiropractic, it's all been done in young or elite athletes, and not move beyond the age of 50 years old.
Yeah. All right. Well, excellent. Thanks for that. Now, let's just lighten it up a little bit to wind down the interview. What's the best piece of advice that someone's given you about sports chiropractic?
You're talking about a chiropractor they gave me to me, or I can give to the audience?
Well, both. I was going to ask you, firstly, what was the best one that someone gave you about either being a practitioner or being a researcher? And then after that, you can say, well, what would be the best piece of advice you could give the audience that are listening to us?
Okay. Well, the best piece of advice I've been given is always do not assume anything. Never. Never. Even if it comes from someone very knowledgeable, always ask yourself why he said what he said. And then if I decided that is convincing to do something, why I do what I do.
Could you give us a clinical example of that? I know what you're getting at, but have you got an example where somebody came to you and perhaps was told certain things and then you checked and found something different?
Well, sometimes they will talk about things, or they will complain about things, or they will try to say something, and then you need to always try to get to the root of what that individual is trying to say to you. And sometimes we very quickly make conclusions of what is being said, and then probably sometimes we stop listening, and then we take action what we should do, or try to stop the individual telling you what he wants to do, and then you start to advise what it should be done. That I think is very important to be always aware of that. This is always conscious of that.
Well, that's a good piece of advice. Now, in terms of more the practical application of either being a sports chiropractor or a sports chiropractic researcher, what would you say to new graduates about what things should they learn or should they pursue if they want to become a sports chiropractor or a sports chiropractic researcher, in your opinion?
Yeah, in my opinion, and this is what I find, this is a journey, and you can see over the last couple of years I changed in that. Sometimes we come with a lot of bias. Sometimes we come with very centralized. We think chiropractors or sport chiropractic is in the center of the world of the athletes. We have this in the United Kingdom where we know that we can do a very good job. But we are a small profession, and sport chiropractor within the chiropractic field also we are even smaller. So it's always look for the big picture. Try to understand that if we're looking into sport, it's a manual therapy, or the team that is a multidisciplinary area that we need to understand what could be our role of contribution, and always try to bring it from the point of view that what others want you to contribute, and not just not impose you're right because you know that you're good. It's just wait for that to ask you to contribute.
Okay, so and just to finish up now, I'd just like to ask you, is there anything else that you'd like to present or discuss before we move along? Is there anything you feel really important to mention?
Well, I think as a whole, everyone knows the need of more research in the chiropractic profession, and I cannot put stronger that sport chiropractors, we need to do more research. Not just quantitative, but also qualitative research. Also, not only about just pre and post intervention, but a lot of understanding the mind of the athlete, what is looking for us, or why they want the manual therapy service, or maybe what they want the sport chiropractor to help them.
So you're looking at some of the contextual effects and things of that nature there, and just motivations to seek chiropractic care?
Possibly.
Yeah. Okay. Well, look, thank you very much for your time this morning, Claudio. It's been lovely chatting with you. So what I'll do now, I'll just throw it over to to Meg, our moderator, if there are any questions, and we'll go from there. Thank you very much.
So we don't have any questions so far, but everybody watching today, feel free. I know that we have a lot of people who watch our replay. So hi everyone, I'm Meg. I'm the questions genie, kind of behind the scenes on these streams. But if you do have any questions for Henry or Claudio, feel free to ask them at any time when you're watching the replay, because we're all a big family here at Fix, and we'll answer them at any point. So thank you so much, Henry and Claudio, for being with us today.
Thank you very much.
Thank you.
Cheers.
See you guys.
Bye-bye.